On this Tuesday night, V-Day in the UK. The world's first clinically approved COVID-19 vaccinations begin.
I'm happy it's happened.
What Canada can learn from the UK rollout and why people in long-term care likely won't get the initial doses.
The logistics of this are a nightmare.
Plus, how the first doses in Canada will be doled out. Dire new predictions for Alberta and the new restrictions finally on the way. Rising food prices on the menu for 2021. What's driving up costs? And the pilot who blazed a trail.
The first human to crack the sound barrier.
The tremendous achievements of aviation hero Chuck Yeager.
Global National with Donna Friesen.
Good evening and thanks for joining us. After weeks of warnings from doctors about the virus spreading in Alberta virtually unchecked, Premier Jason Kenney now says hundreds, if not thousands of Albertans could die unless new public health measures are imposed. As of today, all indoor and outdoor social gatherings are banned in Alberta. Masks are mandatory in all public indoor spaces, including workplaces. But it won't be until December 13th, 4 days from now, that other restrictions kick in, including a ban on indoor dining and the closure of casinos, bingo halls, fitness centres and hair salons. Premier Kenney said he'd only impose these kinds of restrictions as a last resort. Alberta seems to have reached that point. The question is whether it's too late.
Across Edmonton, hospitals have been expanding their COVID wards by the day, the patients arriving in a seemingly endless stream.
We know that we're already behind the 8 ball in terms of the next 2 weeks, but I think it's after that, if we do absolutely nothing right now, we are going to be in crisis come January.
The high case numbers.
A day after Alberta's top doctor made it clear that without new measures, infection rates would only rise, Alberta's premier says new restrictions are now required to prevent hospitals from being overwhelmed.
We know that if we allow viral spread at current growth rates, we will eventually run out of hospital capacity. That is not an opinion, it is a fact.
The new measures include a mandatory mask mandate. Casinos, restaurants, pubs and hair salons will also be closed.
We are now at a place where viral transmission is so widespread in the community that it does not any longer matter how careful business operators are. These are decisions that we have arrived at not as a first resort, but as a last resort to protect lives and to preserve our healthcare system.
Small business owners in Edmonton were among those calling for the new restrictions. In an open letter Tuesday, the Edmonton Independent Hospitality Community wrote, "We cannot access extended federal support because a formal lockdown has not been instituted. Prioritizing the economy over COVID suppression is a false dichotomy." The new measures follow an ultimatum delivered Monday by Alberta's big city mayors. If the province wasn't going to act, the cities would. Still, this isn't a full lockdown. Retail stores have to further limit capacity, but shopping malls can stay open, meaning a scene like this at Calgary's Chinook Centre on Black Friday could be possible come Boxing Day. Places of worship will remain open as well. The new measures come into effect at midnight Sunday and will remain for at least 4 weeks, the lives of hundreds of Albertans now depending on whether they succeed. Heather Yourex-West, Global News, Calgary.
In Manitoba, Code Red public health restrictions have now been extended into early January. That means no gatherings outside your household over the holidays.
That's going to be difficult. It's going to be lonely for many. But the best thing we can do now for our loved ones is to stay apart so that we may be together in person next year.
Today, Manitoba reported 245 new cases and 13 more deaths. The Premier says there are signs the restrictions are starting to work, but he says now is not the time to let up. Now, to a milestone moment, the first dose of optimism in what has been a dismal year. A 90-year-old woman in the UK has become the first person in the world to receive a clinically approved coronavirus vaccine. Just before 7 a.m., retired jewelry shop assistant Margaret Keenan made history, getting the first dose of the Pfizer-BioNTech vaccine. She turns 91 next week and said this is the best early birthday present she could wish for. It is welcome news, not just in the UK, but around the world. So much hope of a return to normal life resting in these tiny vials. It's been just 332 days since the first death from COVID-19 was reported in China, and it's since invaded every country, infecting more than 67 million people and killing more than 1.5 million people. These initial doses of the Pfizer-BioNTech vaccine are the start of the world's biggest mass vaccination program. Canada is on track to be next in line to get it. Because it needs to be kept at minus 80 degrees, it is a logistical challenge. In the UK, the first doses did not go to residents in care homes. It was given to people aged 80 and over who are already in the hospital, along with nursing home workers and some healthcare staff. Crystal Goomansingh on what's been dubbed V-Day in the UK.
I'm happy it's happened, and now I've done it, and hopefully it'll help other people to come along and do as I did.
Do as I did might be the 2020 version of the old Rosie Riveter We Can Do It campaign. COVID-19 has been talked about in battle terms, and Margaret Keenan is the face of Britain's vaccination counterattack.
So make this arm floppy and this arm floppy, all right?
No, bossy boots.
That's why I'm in Navy, sir.
People over the age of 80 and some medical workers are the priority. 50 hospitals are being used as vaccination sites because the Pfizer-BioNTech shots must be kept at minus 70 degrees Celsius. The mass vaccination effort is a historic step forward for the UK.
I'm feeling very emotional today. It is really quite remarkable. We, less than a year ago, were treating the first patient with COVID.
The virus has caused immense anguish. Families kept from dying, loved ones, non-urgent surgeries canceled, and medical staff pushed to the edge.
I mean, in terms of how the nursing profession is feeling in the UK, they are tired, they're exhausted, they have had an extremely stressful year, 2020.
But it's not over yet. Millions need to be inoculated. So far, the government has enough vaccine for 400,000 people, but some fear a shot produced in just 10 months.
It's safe, it's the right thing to do, it's good for you, and it's good for the whole of the country.
They want to know how it applies to them, what are the risks, and how would they be able to obtain it. So we've got a big public health communication task ahead of us in the UK, and indeed, I'm sure, in other countries.
The hope is eventually the vaccine will shield society from its current enemy. Crystal Goomansingh, Global News, London.
Those planning the vaccine rollout here in Canada are closely watching the UK to see what lessons can be learned. Although the hope in the UK was to vaccinate residents in long-term care homes first, that is not happening with this Pfizer vaccine. And today, Canada's chief public health officer said it may not happen here either. The initial doses are likely going to be given to people who can physically get to one of the 14 vaccination sites.
The concept at the beginning of rolling out the Pfizer vaccine is to try and sort of keep it at the point of use. That's for a start. But it's true that you cannot move residents very easily from a long-term care facility to a vaccination site. So that's just the realities.
Health Canada is expected to approve the first vaccines later this week. Working out the delivery plan is like piecing together a jigsaw puzzle involving the federal government, the provinces, and the vaccine manufacturers. Mike Dorley looks at how Canada's vaccine rollout is coming together.
In a research centre not far from Ontario's legislature, in a nondescript hallway adjacent to a row of lockers, sit the most important freezers in the country.
We just need the vaccine. As soon as it arrives, we're ready to go. Gnawing at the bit right now.
How ready is debatable, since the initial delivery of doses from Pfizer need to be stored at minus 70 Celsius or colder. Once the vaccine begins to thaw, it's only good for a few hours, meaning Canadians will have to go to where the freezers are. And the most vulnerable Canadians are also the least mobile.
It's a rapidly evolving situation, so I think everyone has to remain flexible and adaptable.
Complicating matters is the continuing surge of COVID-19 cases, as well as more outbreaks in facilities like the 242-bed Westside long-term care home in Toronto, which has had 117 residents and 57 staff members contract the virus in the last month. nobody is going in or out. And Dr. Dawn Bodish says it's likely the outbreak will need to pass before residents can be safely immunized. The best option right now, she says, is to immunize the staff.
The logistics of this are a nightmare. The logistics are an absolute nightmare. How do we get this vaccine to our country frozen? The fact that we don't have manufacturing on site is a problem. And then once it gets here, how do we distribute it equitably?
The first vaccine has yet to be doled out, and already the concerns are as big as the plan itself. Plans which epidemiologists hope aren't written in stone.
You know, a good plan is better than a perfect plan, and so getting more arms and needles together and not really having much of a planning time where the vaccine is sitting in fridges is a whole lot more important now.
Mike Drolet, Global News, Toronto.
Administering the vaccines once they are delivered is up to the provinces and territories, and they're developing plans and priorities based on their populations. David Aiken explains what we know about that.
38 million Canadians, but there's only enough of the first batch of vaccines from Pfizer for about 125,000 people to get their first dose by year end. So how to divvy that up? Ottawa and the provinces have agreed to share those first doses on a per capita basis. So that means about 48,000 in Ontario will get their first shot by year end, 28,000 in Quebec, 17,000 in BC, 14,500 or so in Alberta, and less than 5,000 in every other province. Because of logistics issues associated with Pfizer's vaccine, none will get their dose for now in the 3 northern territories. But the provinces have sole jurisdiction when it comes to deciding who will be first in line, and each province is making slightly different decisions. Most put residents of long-term care facilities at the top of the priority list, while Ontario and Alberta insist staff as well as residents in long-term care homes get top billing. Quebec puts long-term care staff and all healthcare workers in that province, that's about 325,000 people, as its second priority group. Ontario's number 2 group is anyone who works or studies in a hospital, and that would include everyone from food preparation people to maintenance crews to doctors and nurses. Alberta's number 2 priority group is anyone over 65 living on a First Nations reserve. Once those groups are done, each province moves to its third priority. In Alberta, that's anyone over 75 years of age. Ontario will move next to focus on adults in Indigenous communities, while Quebec will vaccinate seniors living in retirement homes or private group residences. Still, federal officials continue to insist that every Canadian who wants a vaccine will get it, though it may take until the end of next year to complete that objective. David Aiken, Global News, Ottawa.
Nova Scotia has explained its plan to roll out the vaccine. The first shipment of nearly 2,000 doses is expected to arrive by December 15th. Frontline healthcare workers are first in line. Long-term care residents and staff and people over 80 will be immunized during the first 3 months of 2021. It will most likely be the summer before the vaccine is offered to the broader community in Nova Scotia. The U.S. President-elect Joe Biden is promising to deliver an ambitious inoculation program as soon as he takes office.
100 million shots in the first 100 days. And we'll follow the guidance of science to get the vaccines to those most at risk.
The weeks before that, though, will not be easy. The U.S. continues to lead the world in COVID cases and deaths, and among the victims are those who worked hard to save lives. Dr. Carlos Araujo Preza was a specialist in respiratory diseases in Houston, Texas. An immigrant from El Salvador, he cared for the sickest coronavirus patients. In April, he slept almost every night at the hospital, always on call. In November, he got sick himself. He ended up in the intensive care unit where he served as the critical care director. He was eventually put on a respirator. He died November 30th.
My dad will never see me graduate from my master's program. He'll never give me away at my wedding. He'll never see his grandkids.
Coming up, growing grocery bill. What's in store for 2021? Air Canada is cutting more services in Atlantic Canada. In the new year, the airline will suspend all flights to Sydney, Nova Scotia, effectively cutting off Cape Breton Island from all commercial air travel. It's also cutting routes into Deer Lake, Charlottetown, Fredericton, and Halifax. In June, Air Canada announced the indefinite suspensions of 11 routes in Atlantic Canada. WestJet also suspended 80% of its Atlantic capacity in October. It's been a difficult year for many Canadians who are trying to make ends meet, and the cost of putting food on the table could be another hurdle next year. The latest edition of Canada's Food Price Report anticipates the cost of groceries will go up in 2021, some items by as much as 6.5%. Mike Armstrong explains why.
Something rare happened in the butcher business in 2020. The price of chicken, beef, and pork all went up. And butcher shop owner Patrick Dubo says that doesn't usually happen at the same time.
It is rare. Usually you have one that's able to save the other.
Well, there's a prediction it's going to happen again in 2021. If anyone was hoping their wallet might get a break, that doesn't appear likely.
Unfortunately, our models are suggesting otherwise.
Professor Sylvain Charlebois is the project leader behind the Canadian Food Price Report. Its prediction for 2021 would see a jump in the cost of most basic items in a shopping cart. Baked items will go up 3.5 to 5.5%, vegetables 4.5 to 6.5%, and the same for meats. One of the biggest culprits is COVID-19. For example, meat producers have struggled. At times, packaging plants have had to be closed due to outbreaks. But it's not just that part of the supply chain that's a problem. It's all of them.
It's costing more to do everything in livestock and in processing.
The other big issue is weather and climate change. 2020 was a difficult year for growing in much of the U.S. That's meant, for example, produce grown here in Canada that would usually stay here is being sold to other markets and prices are going up. Put all those different increases together, and what does it mean for the wallet? Well, an average Canadian family of 4 is spending about $12,508 on food in 2020. Next year, that's predicted to be close to $14,000, an increase of $695, about 5%.
I mean, that is a lot of money, man.
When food prices increase, it affects the most vulnerable most of all and drives up the need for food banks. But it also makes it harder for those food banks to buy what they need. Mike Armstrong, Global News, Montreal.
Ahead, Will and Kate join the Queen to pay tribute to frontline workers in the UK. Reaching the summit of Mount Everest is quite a feat, and it turns out the climb is a little bit higher than everyone thought. Nepal and China, the countries Mount Everest straddles, have agreed the world's largest peak is 8,848.86 meters high. And that is 0.86 meters higher than the original survey done back in 1954. For years, the two countries have disagreed on the height of Everest. China's measurement only included up to the rock peak. Nepal's calculation apparently included the snow packed on top of the rock. Well, for the first time since March, Britain's members of the royal family have reunited for a special tribute. The Queen, Prince Charles and Camilla, plus Prince William and Kate met outside Windsor Castle to thank frontline staff and volunteers who have been working through the pandemic. The event marked the end of Prince William and Kate's Royal Train Tour, a 3-day trip to thank workers across the nation. The remarkable life of Chuck Yeager next, a salute to the first supersonic pilot. We end tonight with the story of a humble man who pushed humankind beyond all limits. Chuck Yeager died last night at the age of 97. He was a test pilot, the first to fly faster than the speed of sound, and he blazed a trail for others, including Canadian astronaut Chris Hadfield. Hadfield paid tribute to Yeager today, calling him a brave and singular man who served his country, expanded scientific understanding, and inspired me. Eric Sorensen on a man whose achievements sent America's dreams into the space age.
His daring spins, training to be a pilot in the Second World War, showed he was a natural in the cockpit. And when he shot down 5 German planes, he qualified as an ace in a single day. But Chuck Yeager's mark on history would come 2 years after the war, as a test pilot in the X-1, a rocket plane built to break the sound barrier.
We didn't even know that we would ever break Mach 1. It didn't make any difference to me whether I thought the airplane would go fast and sound. I was assigned as a test pilot on it, and it was my duty to fly it.
Yeager dropped clear. From the belly of a B-29, the X-1 was dropped into the sky in October 1947. The rest was up to Yeager. Scientists didn't know whether the plane would break apart or whether Yeager would survive smashing through the speed of sound.
And he does it. The first human to crack the sound barrier.
The cockpit shook furiously. That moment recreated in the Hollywood film The Right Stuff.
I'm still going upstairs like a bat out of hell. She's getting real active.
Yeager's death-defying achievements blazed a path for the first astronauts who would follow his contrails.
He was supremely self-confident. He was genial, but he had a razor-sharp mind on anything involving high-speed flight.
Yeager would continue to break aviation records. He was the first pilot to fly twice the speed of sound.
You don't look at it as being dangerous. It's something that you're sort of dedicated to, and that's your job, and that's what you're going to do. And you don't really think about the outcome.
Yeager personified the aw-shucks courage that it took to be the first to test life and death at supersonic speeds. He marked the 50th anniversary by breaking the sound barrier again.
I just tell people I'm no hero. I'm just a kid that, you know, it's the right place, the right time.
Chuck Yeager didn't actually believe in having the right stuff. He believed in hard work and learning from experience. The secret, he said, was that somehow he always managed to live to fly another day. Eric Sorensen, Global News, Toronto.
And that is Global National for this Tuesday. I'm Donna Friesen. Tonight's Your Canada is to Jack Lake in Banff National Park. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.